have a technically adapt mentality. You should be able to work in stressful situations. You should be a very good communicator. You should have sound critical care thinking skills. You should be a team player, flexible, committed, and the most important is you should have patience, because you have to wait for till the time the patient recovers. So you've got a lot of skills. The most important is you should be time clear. You should be have 24-hour support, flexible, committed, dedicated, and for all these skills you require to be passionate about the critical care science. When we talk about a course, we should have some goal and objectives when we think about any training course. Then you should think about what are the training tools you are going to be, how you are going to make your curriculums, how you are going to assess your tools, whatever you have applied for it. And the most important is that you should have a simulation at the end of it so that you know how you are being able to train the people. So there are different working methods. You should have lectures, case discussions, interactional learning, team discussions, action learning, that is an experimental learning. You do practice yourself, do some water drills. Then there's a plenum discussions. Then there should be a reflecting sessions at the end of the day or the next day when you have to think about whatever we have done in last years. Just and you should have in between the binders and breaks in between so that it should not become too boring. If you see the choice of methods of learning, if you go by lectures, you just learn by 5%. If you read, you learn by 10%. Audiovisual improves in your learning capacity by 20%, and that's the reason we have kept the different videos for the different kinds of scenarios so that will help to grasp you more. Demonstrations is going to help more, 30%, and that's the reason we have work sessions and we have a central demo. Study group, that gives you, when you take part in discussion, it gives you, help you to improve your skill further, learning skill further. When you try to do it by yourself, that is going to help you more. That's you will learn by 75%. That's the reason there's a work sessions, and you should try to do hands-on by yourself so that you learn more. And most important is teaching others helps the most. That's usually 80%. That's the reason probably we learn the most when we deliver our lectures. So come to the course overview. It's a comprehensive advanced level educational course. Will provide both theoretical and theoretical knowledge of ECMO, when to do ECMO, why to do ECMO, and how to do ECMO. The practical skills about the ECMO components, the circuit management, with the help of water drill. With the help of simulation, we'll try to develop the thinking process, communicative skills, and the behavioral skills, and observational and clinical skills through the basis. So you have been given a study material which includes your ECMO specialist training manual, which has got a program evaluation sheets. You have got an ELSO statistics of 2017, ECMO consent form, data for record forms, ECMO trial forms, ECMO stock, and you will be given slide presentations at the end. And you have an ECMO compendium, ECMO volume 1 and volume 2. These 3 books have been given along with study materials. So we'll have a lecture series, water drill, simulation, finally the exams, and then you can think about clinical perspectives and CME. Clinical perspectives is those who are interested, they can get themselves registered. So whenever we are doing an ECMO in your nearby city, we can give you a call and you can come and attend the ECMO live basis every time. It's not that necessarily we have ECMO cases every time. So whenever we have ECMO cases and we go all over India to do an ECMO, so wherever we are, suppose we are there nearby your city, then we can call you up and you can come and join us for the ECMO course. So those who are interested in clinical preceptorship, they can ask, they can just give their name to the registration so that you can preserve your numbers and can call you whenever required. So there are total 42 lectures, 14 hours of practical training during this course. Okay. And there are a few things which we keep on repeating, but that is to give some more emphasis on that topics. You will be divided, there are 4 sessions we kept for today and tomorrow for practical trainings. You will be divided into 8 groups, each is going to be A1, A2, like that. It will subdivided into A1, A2 groups. Each group is going to be 9 members, and we are planning to divide the group in a way that there will be one surgeon, one perfusionist, one anesthetist. So it may not be that your entire team will be there with you. We try to keep the team as far as possible, but then there might be some might to go to other groups also. But that is just to maintain the ECMO team so that whatever you have to perform, we will be able to do it better. We will be having a central demo here for whatever practicals we are going to do, and after finishing with the central demo, we will take you to the different stations and you will be rotated, and there you have to do your hands and by yourself. It includes live demo, videos and simulations. Simulation will be done mainly on the 4th of June, the last day. There will be 8 scenarios will be conducted, one for each team. Each team will be called. We'll create some scenarios and you have to observe, diagnose, and that will be marked. There will be an exam set, MCQ kind of exam, which is going to be 40 marks, okay, and 10 marks which I told you about the practical exams. As I already told you about the clinical preceptorships, optional. It's on you. If you are interested, you can let us know. We will arrange for it. CME will, through our ECMO of India web society website, we will continue to do CME, and those who are interested, they can be a member of the society and we will be a part of the CME. If you come to today's meeting, we have a group of 3 people. It's a combined group of medicals and paramedicals, those intensivists, pediatric intensivists, cardiac anesthetists, perfusionists, and cardiac surgeons, all are involved. And we got people from the different part of the our country and even from the neighboring countries. Okay. What are difficulties we are going to face is that because there's a different crowds here, there will be some problems during language and cultures. People have been doing things in different ways than what we tell. So it is always better to have a discussion about it, and that will help us to improve ourselves also. All of us got a different professional background. Some are cardiac surgeons, some are intensivists, some are nursing staff or physicists. So all of them will be thinking about it in a different way. So we try to adjust our speed so that everybody can able to grasp the things. So ECMO basically gives us a job satisfaction. It demands and improves the communication skills. It's rewarding, but at the same time stressful and demanding. Meticulous attention to detail is paramount, and support network is essential to survive for a good sound ECMO. That is a good communicative skill between the all national and international facilities. It helps us to create a warm and light environment. Contribute your knowledge and experience and doubts and questions so that we can improvise more program and better program. That's just an introduction about how we are going to conduct the course. I think now without wasting more time, I'll straight away go to my first talk. If there's any questions?